Hello and welcome to my YouTube channel, AnatomyMentor. Today we're going to be discussing a topic of gross anatomy. We're going to be discussing the region which is the gluteal region. This is a very important discussion topic, and today I'm going to be talking about the topography, the cutaneous nerve supply, and the fasciae of the gluteal region. Also, I shall discuss the bony and ligamentous parts of the gluteal region and the formation of the very important foramina, that is the greater and lesser sciatic foramina. And also I'll be enumerating the structures which are passing through these foramina. And also I shall discuss the attachments, nerve supply, action, and clinical anatomy of the muscles of the gluteal region. Also the nerves and arteries which are present in this region and their passage through the sciatic foramina. So starting with this region, which is the gluteal region, it is, remember, the transitional area between the trunk and the lower extremity. And anatomically, it is a part of the trunk, but functionally, it is considered a part of the lower limb. It includes the rounded posterior buttocks and laterally located hip region. Now, the gluteal region has two junctional zones. The first is between the limb and the abdominopelvic cavity via the greater sciatic foramen. And then the second one is between the limb and perineum via the lesser sciatic foramen. Now, let's look at the cutaneous nerve supply of the gluteal region. Now, to remember the cutaneous nerve supply of the gluteal region, we can simply divide it into 4 sections or regions. So here you can see I'm dividing the gluteal region of the posterior aspect of the right lower limb into 4 regions. And here is the upper outer quadrant where the cutaneous nerve supply is through the iliohypogastric and subcostal nerves. And if we look at the upper medial aspect of the gluteal region, it is supplied by the first, second, and third lumbar and first, second, and third sacral nerves. Whereas the lower lateral region is supplied by the lateral femoral cutaneous nerve, which emerges from the lumbar plexus, and its root value is L23. The lower medial aspect, the lower medial quadrant, this is supplied by the posterior femoral cutaneous nerve thigh, which is a branch of the sacral plexus, having root value S123, and the perforating cutaneous nerve with the root value S23. So now let's look at the passageways which are prominent in the gluteal region. So over here, this is a very good diagram of the bony pelvis. And we can see over here that this larger arrow over here is representing the gap between the inguinal ligament and the pelvic bone. And through this gap, the structures which pass are the psoas major and iliacus muscles, pectineus as well, and the vessels which are the femoral vessels, lymphatics, femoral branch of genitofemoral nerve, and the lateral cutaneous nerve of the thigh. Also, we can look over here and we shall see the greater sciatic foramen. Now, this is a passageway which is transmitting the superior gluteal nerve, artery, and vein above the piriformis muscle. Also, it is transmitting those structures which are passing downwards. And these structures are the ones which are passing below the piriformis, and these are the sciatic nerve, the inferior gluteal nerve, artery, vein, pudendal nerve, internal pudendal vessels, posterior femoral cutaneous nerve, the nerve to obturator internus and superior gemellus, and nerve to quadratus femoris and inferior gemellus. So this here is the greater sciatic foramen. It is transmitting those structures which pass from the pelvis into the gluteal region, and also the structures which are passing from the pelvis and via the gluteal region, they are going to enter the lower limb. Then we can see the lesser sciatic foramen over here. This is the passageway for the obturator internus tendon and also the pudendal nerve and internal pudendal vessels which are going to pass from the perineum, that is the portion of the pelvis below the pelvic diaphragm, that is the perineum. From here, the structures, they are passing into the gluteal region through the lesser sciatic foramen. So this is a summary of the passages. Now let's look at the boundaries of the gluteal region. Superiorly, it is bound by the iliac crest, and inferiorly, you can see over here by the gluteal fold. Medially, there is the natal cleft, and laterally, at this point, is the greater trochanter of the femur. The gluteal muscles, remember, they form the prominent mass of the gluteal region. Now, let's look at the surface anatomy of the gluteal region. The important landmarks, those points which can be palpated, are over here. The iliac crest, which is labeled 4, with the posterior-superior iliac spine, which is labeled 7. Then the tip of the coccyx, which is labeled 9, lying within the natal cleft, deep within the natal cleft, are palpable. Also, number 5 over here represents the ischial tuberosity. This is also a palpable landmark of the gluteal region. Keep in mind, we sit on our ischial tuberosity, and the number 10, which is representing the greater trochanter of femur, is also a palpable landmark. Also keep in mind over here, a key feature of the gluteal region is the piriformis muscle. And if we want to trace the piriformis muscle on the skin, then what we do is that we draw a line from the posterior superior iliac spine to the tip of the coccyx, and then a point which is midway on that line. That point is chosen, and from there, then we would stretch a line towards the greater trochanter of the femur. This line is now representing the lower border of the piriformis. So this is how you can locate the piriformis muscle in the gluteal region, and we're going to look in the further slides and understand why piriformis is such an important landmark in the gluteal region. Now, first talking about the fascia of the gluteal region, remember the deep fascia of the gluteal region is continuous with the deep fascia of the thigh, and the deep fascia of the thigh is known as the fascia lata. Now, what happens is that at the lower border of the gluteus maximus, this here fascia lata of the thigh, it splits to enclose the gluteus maximus muscle, and above the gluteus maximus, the deep fascia continues as a single layer covering the gluteus medius muscle, and it is attached to the iliac crest. Laterally, this fascia of the gluteal region will merge with the iliotibial tract. This is the iliotibial tract, which is a thickened band of deep fascia of the thigh on the lateral aspect. Let's summarize the attachments of the fascia lata, which is a commonly asked question. Well, anteriorly, it is attached to the inguinal ligament and the anterosuperior iliac spine. Laterally, it is attached to the iliac crest. Posteriorly, it is attached to the sacrum, the sacrotuberous ligament, ischial tuberosity, the body of the pubis, and the ischiopubic ramus. So these are the attachments of the deep fascia of the thigh, also known as the fascia lata. The facial skeleton of the thigh, that is the fascia lata, is in the form of a tough circumferential stocking which constrains the musculature. Septi pass from the deep surface of the facial sheath to the bones, confining the muscle groups to osteofacial compartments. And also it gives an additional area for attachment of muscles. It is thickened laterally to form the iliotibial tract. Now, coming back to the gluteal region, let's look at the bony parts of the gluteal region. Keep in mind, the bony pelvis is formed by the union of 4 bones. That is the 2 hip bones and the sacrum in the midline and the coccyx. So these are the 4 bones which come together to form our bony pelvis. And here you can see the portion of each hip bone, which is the most superior part. The flattened part is known as the ilium, and it is superficially having a ridge known as the iliac crest. And on the internal aspect, it is depressed slightly. This area is known as the iliac fossa. Then let's look at the other two parts of the hip bone. That is this portion over here, which is known as the pubis. And then we can see the lower part, inferior thickened and sturdy part, which is the ischium. So these are the three parts of each hip bone, the ilium, pubis, and the ischium. And if we look at the pubis, we have a superior pubic ramus and the inferior pubic ramus. And the superior pubic ramus, medially, it is elevated in the form of a pubic tubercle. Whereas this is the lower part, the ischial tuberosity. I already mentioned to you that we sit on our ischial tuberosity, and on the medial aspect, it is pointed, and this portion is known as the ischial spine. If we look at the joint which is formed between the anterior aspects of the two hip bones, that is the pubic symphysis, it is a cartilaginous joint lying in the midline. Also, I would like to highlight over here the two very important ligaments in the pelvic region. The first is the sacrotuberous ligament, which passes from the sacrum to the ischial tuberosity, and the second is the sacrospinous ligament, which passes from the sacrum to the ischial spine. Now, these two ligaments convert the greater and lesser sciatic notches into foramina. Foramina, the word foramen, foramen is a plural of foramen. Foramen literally means an opening. Also keep in mind, this here is the obturator foramen. This is the oval opening, the oval gap or space which is created between the pubic and the ischial rami. Here is the acetabulum. This is present on the outer surface of each hip bone. It is the socket, which is the site of articulation with the head of the femur, forming the hip joint. Also, you can appreciate this here is the anterosuperior iliac spine, and here is the anteroinferior iliac spine. Let's also look at the important bony features of the femur bone, that is the thigh bone, when we're talking about it in relation to gluteal region. Well, here is the head of the femur, and anteriorly you can see this is the greater trochanter, the lesser trochanter. If we look at the posterior aspect of the femur, we can see its shaft has a ridge which is known as linea aspera, which is thickened in the upper part, and this portion is known as the gluteal tuberosity. Also, you can see here the greater trochanter and the lesser trochanter. These are the prominent parts of the femur bone. And in the lower part are the two rounded protuberance known as the femoral condyles. Now let's talk about the gluteal ligaments. I just mentioned before, sacrotuberous, and the other one is sacrospinous ligament. Their importance is that they stabilize the sacrum and they prevent its rotation at the sacroiliac joint by the weight of the vertebral column. The sacrotuberous ligament connects the back of the sacrum to ischial tuberosity, while sacrospinous ligament connects the back of sacrum to ischial spine. And these two ligaments, as I mentioned before, they convert the greater lesser sciatic foramina, the greater lesser sciatic notches into the foramina. So here we are looking at the posterior view of the bones and ligaments of the pelvis. And now we can see over here, this is the sacrotuberous ligament. Here is the sacrum bone. Now from the back of the sacrum bone, this ligament passes towards this ischial tuberosity. And here is the sacrospinous ligament, which passes from the back of the sacrum to the ischial spine. So these two ligaments have converted the greater and the lesser sciatic notches into greater and lesser sciatic foramina. So here the foramina have been highlighted to make it easier to understand. This blue region is representing the greater sciatic foramen, and this red region is representing the lesser sciatic foramen. And here is the sacrospinous ligament, and this is the sacrotuberous ligament. Now, these two foramina are extremely important because they are the, you could say, the passageways for very important structures between different regions of the body. The greater sciatic foramen can be likened to a door that provides an exit for structures from the pelvis into the gluteal region. Now, the piriformis muscle is an important anatomical structure that passes through the greater sciatic foramen, and this can be used as a landmark to remember the other structures. So let's just summarize the anatomical structures which are passing through the greater sciatic foramen. Those structures which are passing above piriformis are the superior gluteal nerve and vessels, whereas those structures which are passing below piriformis are the sciatic nerve, the posterior cutaneous nerve of the thigh, the inferior gluteal nerve and vessels, nerves to obturator internus and quadratus femoris, the pudendal nerve, also the internal pudendal vessels. So let's look at these in a diagram which is representing the gluteal region partially dissected. And you can see over here, this is the sciatic nerve, which is a large, prominent, important nerve, which is passing through the greater sciatic foramen. So this is a structure which is passing from the pelvis into the gluteal region through the greater sciatic foramen. And its passageway is below this piriformis muscle. This is the piriformis muscle, which is also passing through gluteal region. Below it is the sciatic nerve exiting the gluteal region. Along with it is posterior cutaneous nerve of thigh. And you can also see the inferior gluteal nerve and vessels, as well as the internal pudendal nerve and vessels. And also you can see the pudendal nerve and internal pudendal vessels. So these are the structures which are passing through the greater sciatic foramen below piriformis. And also the nerve to obturator internus has been highlighted over here. Whereas above the piriformis, you can see also you have got the superior gluteal artery and vein, as well as the superior gluteal nerve. They're also passing through the greater sciatic foramen, but above the piriformis. So these are the important structures which pass through that foramen. Now let's talk about the lesser sciatic foramen. This foramen provides an entrance for the following structures into the perineum. Now, perineum is the part of the pelvic cavity which is lying below the pelvic floor. And through the lesser sciatic foramen, the structures which are going to enter the perineum are the pudendal nerve and the internal pudendal vessels. Also, the nerve to obturator internus. Also, it is an exit way for the tendon of obturator internus. So these three structures are entering the perineum through lesser sciatic foramen, whereas the tendon of obturator internus is going to leave the perineum through the lesser sciatic foramen. So let's now look at the structures passing through this here. Lesser sciatic foramen, you can see the internal pudendal vessels and the pudendal nerve, as well as the nerve to obturator internus. So these are the structures which are passing through lesser sciatic foramen, and here is also the tendon of the obturator internus. Now, I particularly like this diagram because these arrows are showing the direction of passage of the structures through the foramina. So you can see this here arrowhead, it is showing us the structures which are going to pass through the greater sciatic foramen from the pelvic cavity into the gluteal region. And then further below are also structures passing through greater sciatic foramen into gluteal region, but then continuing downwards into the lower limb. Like the sciatic nerve and the posterior cutaneous nerve of the thigh. Then the structures which are passing through the greater sciatic foramen are also some anatomical structures which, although they leave the pelvic cavity, but then they re-enter into the perineum through the lesser sciatic foramen. We just mentioned those structures, the pudendal nerve, internal pudendal vessels, and the nerve to obturator internus. And then the structure which is leaving the perineum through the lesser sciatic foramen, which is the tendon of the obturator internus. So these arrows are representing the different directions in which these anatomical structures are passing through the greater and lesser sciatic foramina. So remember that three anatomical structures pass through both the greater and lesser sciatic foramina. These are pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Now let's come to the muscles of the gluteal region. We can summarize the muscles into two groups based on their location, the superficial and the deep group. Now, the superficial group has four muscles. Three are the gluteal muscles, maximus, medius, and minimus, and one tensor fasciae latae. These are the four muscles which are lying superficially in the gluteal region. Whereas the deeper muscles are five in number, namely the piriformis, obturator internus, the two gemmelli, superior and inferior, and the quadratus femoris. Now, superficial muscles of the gluteal region, we're going to look at them first. Let's look at a summary of their attachments and their actions with nerve supply. Let's talk about the gluteus maximus first. Now, the word maximus itself shows this is a large muscle and this is a very prominent muscle, and this is responsible for the prominence of the gluteal region. And if we look at its origin, it's from the outer surface of the ilium as well as sacrum, coccyx, and sacrotuberous ligament. Its insertion is dual. It splits into two parts. The larger part is inserted into the iliotibial tract. That's the 3/4 of the muscle, whereas the remaining 1/4 is inserted into gluteal tuberosity of the femur. This muscle is supplied by inferior gluteal nerve, and this is the nerve root L5, S1, S2, the nerve roots of the inferior gluteal nerve. The action of gluteus maximus is that it extends the thigh at the hip joint. This is the most powerful extensor of the thigh at the hip joint. Remember that. It also laterally rotates the hip joint. Plus, you know it is inserted into the iliotibial tract, which is eventually going to attach to the lateral condyle of tibia. So through this insertion, it also extends the knee joint. That's an additional action of the gluteus maximus. Now the gluteus medius and minimus muscles, they both have their origin from outer surface of the ilium, and they're both inserted into the greater trochanter of the femur. Their nerve supply is superior gluteal nerve, and they have a common action, which is that they are the abductors of the thigh at the hip joint. So they tilt the pelvis when walking to permit the opposite leg to be lifted off the ground. Now, the fourth one in the superficial group of gluteal region is tensor fasciae latae. Its origin is from the iliac crest and it is inserted into iliotibial tract. So it assists the gluteus maximus in extension of the knee joint. And it is also supplied by superior gluteal nerve. So these three muscles, glutei, medius minimus, and tensor fasciae latae, are supplied by superior gluteal nerve, whereas gluteus maximus is supplied by inferior gluteal nerve. Tendons, remember, they're two important muscles. Their tendons are inserted into iliotibial tract, which we just saw. One is the gluteus maximus, and the second one is tensor fasciae latae. So remember that these are the two muscles which are inserted into iliotibial tract. So just a reinforcement of what I just told you, which is the strongest extensor of the hip? Your answer is gluteus maximus. This gluteus maximus is the strongest extensor of hip joint, although the hamstrings on the posterior aspect of thigh are also extensors of the hip joint, but the strongest one is the gluteus maximus. Now, if we look at the origin of the gluteal muscles, you can see these shaded areas which are on the outer surface of the ilium are representing the sites of origin of gluteus medius and minimus. So this red portion between posterior and anterior gluteal lines is representing the origin of gluteus medius, whereas the orange part between anterior and inferior gluteal lines is representing origin of gluteus minimus. Both muscles are inserted onto the greater trochanter of the femur. And they are partially covered by this larger one, which is the gluteus maximus muscle. It has a broader origin. Its origin is from the posterior, also from the outer surface of ilium, posterior to the posterior gluteal line, but also from the sacrum and the coccyx. And this muscle, as I told you, its insertion is dual insertion. The 3/4 of this muscle is inserted into the iliotibial tract, which is the thickened band on the outer lateral aspect of the thigh. 1/4 of the muscle is inserted into gluteal tuberosity, which is the prominence on the posterior aspect of the upper part of the shaft of the femur. And here we can see all of these muscles together. You've got the gluteus maximus. Its origin is from the you can see from the outer surface of the ilium, posterior to posterior gluteal line, and here it is being inserted into gluteal tuberosity. This here is the gluteus medius, and here is the gluteus minimus. And you can also see this here iliotibial tract, which is the thickened deep fascia of the thigh on the lateral aspect, which is then inserted into the lateral condyle of the tibia. Now, the applied aspect, when we're talking about the gluteal muscles, a commonly asked question during the exams, or if you're a medical student, then you might also be expected to examine the patient and identify the condition, which is Trendelenburg's gait. This is a clinical condition which results due to the paresis, that is the weakening or the paralysis of the muscles which are gluteus medius and minimus. And their weakness will cause a defective hip abductor mechanism leading to a particular gait which is known as Trendelenburg's gait, in which there is a drooping or sagging of the pelvis to the contralateral side while walking. So here is a diagrammatic representation of comparison of Trendelenburg gait with the normal gait. Now, normally you can see over here that it is the gluteus medius and minimus muscles of the left side. If they are normal during walking, their contraction facilitates the leg of the opposite side, that is the normal, this is the opposite side, the contralateral side, to be lifted or cleared off the ground, above the ground. Now, if these gluteus medius and minimus, we are supposing over here of the left side, if they are paralyzed or if they are weak, then this opposite side, the leg of the opposite side, which is in this case the normal side, this leg will not be lifted off the ground. It will, you can see, sag down or droop. It is due to the drooping of the pelvis, which is tilting downwards, and this is known as the positive Trendelenburg sign. So this shows a defective hip abductor mechanism. Now let's come to the deep muscles of the gluteal region. These are piriformis, obturator internus, the two gemelli muscles, and quadratus femoris. So let's look at their origin. The piriformis is originating from anterior surface of the sacrum, and we saw it passes through the greater sciatic foramen. It is going to be inserted into the greater trochanter of the femur. The obturator internus is arising from inner surface of obturator membrane. This is a membrane which is covering the obturator foramen. It is also inserted into greater trochanter of femur. The gemellus superior arises from the ischial spine, gemellus inferior from the ischial tuberosity. Both these muscles will be inserted into greater trochanter of femur. The quadratus femoris is a muscle which arises from the lateral border of ischial tuberosity and is inserted into quadrate tubercle of femur. These muscles are supplied by the sacral plexus. They have a common action. They are all the lateral rotators of the thigh at the hip joint. So they are also known as the short rotator muscles of the hip. Let's look at these muscles, these short muscles of the gluteal region. The one which is most superior is piriformis. Then you have gemellus superior. Then comes the obturator internus. You can see its origin is from the internal aspect of the obturator membrane, and here it is inserted into greater trochanter of femur. Then you've got gemellus inferior. These muscles, piriformis, superior, inferior gemelli, and in between them the obturator internus, they're all inserted into greater trochanter of femur. And here from the ischial tuberosity is the arising is the quadratus femoris inserted into quadrate tubercle of femur. So these are the short rotator muscles of the hip. They are lateral rotators of the hip. Now this is a mnemonic I'm going to explain to you for the piriformis muscle. Piriformis muscle, as I mentioned before, is a very important muscle in the gluteal region. There are 2 points that you can keep in mind about this muscle. P is for prime, P is for prime, P is for piriformis. So it is a prime muscle. Now, why is it a prime muscle? Because it is used as a landmark for the identification of structures which are passing through the greater sciatic foramen. We always summarize them as structures passing above the piriformis and structures passing below the piriformis. The other significance of piriformis, or a point to remember, is that P is for prime. So the most superior muscle location-wise is the piriformis when we are considering the short rotator muscles of the hip. Okay, so now let's come to the vessels, the arteries of gluteal region. These are superior inferior gluteal arteries. The superior gluteal artery is a branch of internal iliac artery. It enters gluteal region through the upper part of greater sciatic foramen above piriformis. And inferior gluteal artery is a branch of the internal iliac artery that enters gluteal region through the lower part of greater sciatic foramen below the piriformis. And These arteries form two arterial networks or anastomoses in the gluteal region. The first one is the trochanteric anastomosis. It is lying at the level of trochanteric fossa of the femur, and it supplies the head of the femur. And it is formed by contribution of four arteries, which are superior gluteal artery, inferior gluteal artery, medial circumflex femoral, and lateral circumflex femoral. As I mentioned before, the superior gluteal arteries, they're branches of internal iliac artery. Medial and lateral circumflex femoral arteries, these are branches of profunda femoris, which is the deepest branch of the femoral arteries. So this is how a network, an arterial network, is formed around the neck of the femur. The second anastomosis in this region is the cruciate anastomosis. This is lying at level of lesser trochanter of femur. It also supplies the head of the femur, and it is formed by the contribution of four arteries, namely inferior gluteal, medial lateral circumflex femoral, and the first perforating branch of profunda femoris artery. So you can see that the superior gluteal artery over here has been replaced by first perforating branch of profunda femoris. The rest of the three are the same as they were in the trochanteric anastomosis. So this is a diagrammatic representation of the vessels forming anastomosis in the gluteal region. Here is the arterial ring, which is known as the trochanteric anastomosis. Like I mentioned, it is formed by contribution of four arteries. Number one over here, the superior gluteal artery, and then number two, the inferior gluteal artery, and then number three, medial circumflex femoral, and number four, lateral circumflex femoral. These are forming this trochanteric anastomosis, which is an arterial network in the region of the neck of the femur. And you can remember profunda femoris itself is a branch of the femoral artery. Profunda literally means deep. It is the deepest branch of femoral artery. So the other arterial ring or network is the trochanteric anastomosis. Over here, this is the trochanteric anastomosis lying at the level of the lesser trochanter of the femur. And in this case, the contribution is from the first perforating artery, which is also a branch of profunda femoris. Remaining vessels which form this cruciate anastomosis at the level of lesser trochanter are the medial and lateral circumflex femoral and the inferior gluteal vessels. So keep in mind that these anastomoses are present around the region of the hip joint, because during the movements at the hip joint, the vessels might be compressed. So the collateral circulation, it ensures a smooth blood flow during the different movements of the limb, of the lower limb. Okay, so what about lymphatic drainage of gluteal region? Well, this is into the lateral group of superficial inguinal lymph nodes. Concerning the applied aspect, what you should know is the site of the intragluteal injection. So an intragluteal injection, the injections can be safely administered in a particular region of the gluteal of the gluteal aspect, and that is the supralateral quadrant, the upper and outer quadrant of the buttock. This is the area where an injection can be administered safely. So we want to avoid injury to the sciatic nerve and the gluteal nerves. This is the area you can see where the sciatic nerve is present. So in order to avoid injury to sciatic nerve, the injection can be administered in this region, which is supralateral part. Over here, there is a rich vascular network of superior gluteal vessels, and that facilitates the provision of the medicine, or even for vaccination. This is considered a safe area, and it lies between the gluteus medius and minimus muscles. So how can we locate this area? What we can do is that we can draw a line from the posterior superior iliac spine to the greater trochanter, and then from a point midway on this line, we draw a vertical line upwards. Then the outer area external to this vertical line, this would represent the safe zone for administration of the intragluteal injection. Now let's just look at a few MCQs to reinforce our session of today. So which is the tendon of which following muscle inserts into the iliotibial tract? As we have discussed it, it is going to be tensor fasciae latae in all these options. Option C is the correct one. As the tensor fasciae latae tendon, it inserts into the iliotibial tract. The lesser sciatic foramen transmits the following structure. Well, that is the pudendal nerve. We have already summarized the structures which are passing through lesser sciatic foramen. And which of the following anatomical structure passes through the greater sciatic foramen below the piriformis? So here the important point is that they're asking about the structure passing below piriformis. So that is posterior cutaneous nerve of thigh. Whereas this other structure, you can see the superior gluteal artery, the nerve which supplies gluteus medius, that is superior gluteal nerve, they are passing through greater sciatic foramen, but not below the piriformis, above the piriformis. So they are not the correct answers. The correct answer is B. And tendon of rotator internus, doesn't pass through greater sciatic foramen. It passes through the lesser sciatic foramen. So B is the correct option, the correct answer for this MCQ. Okay, so that ends with today's discussion on the gluteal region. And I hope you found it helpful. It was a summary of all the essential aspects of the gluteal region, specifically the greater lesser sciatic foramina and the structures passing through the foramina, and also the muscles of the gluteal region along with their actions. So if you found today's topic interesting and if it was easier for you to understand the gross anatomy, then don't forget to like and subscribe to my YouTube channel, AnatomyMentor. You can do that by simply clicking on my picture, which is going to appear at the end of this video. And I will also be coming up with new video presentations on topics of gross anatomy. And also I cover topics of embryology, neuroanatomy, and histology. So you can follow my YouTube channel and also hit the notification icon for updates of all the new presentations that I upload. Thank you for your time. Happy studying. Take care. Goodbye.